Could the answer to the greatest mental health crisis facing our military veterans be found in a substance that has been strictly prohibited for decades? The Department of Veterans Affairs has just dropped a bombshell announcement, confirming that they are launching a formal trial to examine the safety and efficacy of MDMA-assisted therapy for those suffering from post-traumatic stress disorder. It is a bold, controversial, and potentially life-saving move that is forcing the entire country to rethink the intersection of federal policy, modern medicine, and the sacred obligation we owe to those who have served in uniform. Before we continue, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow and ensures you get the updates that the mainstream media often ignores. For years, we have watched the heartbreaking statistics climb. Thousands of veterans suffer in silence, battling the invisible scars of combat, with current traditional psychiatric treatments often failing to provide the relief they so desperately need. The VA's official statement confirms that this study will look beyond just the treatment of PTSD. They are specifically diving into the impact of MDMA usage for those dealing with severe mental health disorders and, crucially, individuals struggling with alcohol use disorder. This isn't just a small pilot program, it represents a major shift in how the federal government approaches psychiatric care. By opening the door to substances that were once strictly off-limits, the VA is essentially admitting that the status quo is no longer good enough for our heroes. Now, let's break down what this actually means. For the longest time, MDMA, often known by its street name, ecstasy, has been vilified as a dangerous narcotic with no therapeutic value. However, clinical researchers have been arguing for years that, when administered in a controlled, clinical environment, it could help patients reprocess traumatic memories without being overwhelmed by the physiological fear response. This is a game-changer because, for many veterans, the fear response is so high that they cannot even engage in traditional talk therapy. If this trial proves successful, we could be looking at a total overhaul of the VA's mental health protocol. But we have to look at the other side of this. Critics are already sounding the alarm. They argue that the VA is playing with fire, potentially opening the door to substance abuse issues in an already vulnerable population. There is also the political dimension. How will conservative lawmakers react to a federal agency endorsing a drug that has been synonymous with the war on drugs for half a century? The optics are complex, and the stakes could not be higher. If this goes wrong, it will be a public relations and medical disaster. But if it goes right, it could save countless lives that are currently being lost to suicide and untreated trauma every single day. We are seeing a collision between strict regulatory traditions and the desperate need for innovation. The Biden administration is clearly trying to signal that they are willing to take risks to address the veteran suicide crisis, but this move will undoubtedly face rigorous scrutiny from both Congress and the scientific community. It begs the question, is our government finally prioritizing results over rigid, outdated ideologies? Or are they setting themselves up for a failure that will haunt the department for years to come? This is a massive pivot, and the implications for the future of federal healthcare are immense. We are talking about a fundamental shift in how the U.S. government views psychiatric intervention. It is a bold experiment, and it is happening right in front of our eyes. So, what do you think about this? Do you believe the VA should be experimenting with MDMA to help our veterans, or is this a dangerous step in the wrong direction? Drop your opinion in the comments below. I read every single one, and I want to know where you stand on this polarizing issue. Whatever your view, the fact remains that our current system is failing far too many people. If we don't demand better, if we don't hold these institutions accountable, and if we aren't willing to look at all the data objectively, then we aren't doing our jobs as citizens. We will continue to follow this story closely as the trials progress, and you can expect us to bring you the cold, hard facts as they emerge. Thank you for tuning in, and stay vigilant.